All right, so you're at the doctor, right? And they're like, let's do some blood work.
The usual stuff.
Yeah, cholesterol, all that. But then they're like, we're going to check your blood type too. And you're thinking, hold on, isn't that like for if I get in an accident or something?
Right. You don't usually think much about it.
Exactly. But what if I told you that tiny little detail, your blood type, could actually be a clue about your risk of having a stroke, especially at a younger age? We're talking about a recent study in Circulation that's got everyone talking.
It's a big deal. They dug into genetic data from almost 17,000 stroke patients.
Compared to a whopping 600,000 people who hadn't had a stroke.
Huge sample size. Really robust study design.
And what they found was pretty mind-blowing. Turns out, if you've got type A blood, you've got a 16% higher risk of stroke before you hit 60.
Which, 16% might not sound like a ton.
Right, is that a big deal or not?
Well, it's all about shifting the odds. For every 100 people with type A, a few more are likely to have a stroke earlier in life compared to folks with other blood types.
Okay, so let's say you're listening to this and you're in your 40s, maybe 50s, and you're thinking, wait a minute, I've got type A blood. Should I be freaking out?
Not freaking out, but definitely something to be aware of. Knowledge is power.
Exactly. And speaking of, the study also found that people with type O blood actually had a lower risk, like 12% lower. What's up with that?
It's the million-dollar question. They haven't quite figured out why type O might be protective.
There are some theories, though.
Oh, for sure. Could be something to do with how blood clots differently or even variations in cholesterol levels, but more research is needed.
It's like a whole new avenue of research just opened up. But even without knowing the exact why, this study did point to some key players in the whole blood type stroke connection, right?
Definitely. We're talking about things like blood clotting, inflammation, those little platelets in your blood, all crucial stuff.
Okay, so blood clotting first. Obviously, we need our blood to clot sometimes, like if we get a cut. But how does that go haywire in a stroke?
So imagine a clot forming inside a blood vessel in your brain. Uh-oh. Yeah, not good. It's like a sudden traffic jam, blocks blood flow, prevents oxygen and nutrients from getting where they need to go. Brain cells start getting damaged, and that's when you have a stroke.
And inflammation. We hear that word everywhere these days. How does that fit into all of this?
Right. So inflammation is actually a good thing initially. It's your body's way of fighting off invaders, like when you get a cut and it gets red and swollen. But if you've got this low-level inflammation simmering all the time...
Chronic inflammation.
Exactly. Can damage the lining of your blood vessels, making it easier for clots to form.
So it's like those snags you get in an old hose?
Perfect analogy. And then you've got those platelets.
The tiny first responders.
Exactly. They're essential for clotting, but if they get too sticky or clump together too easily, it's another risk factor for stroke.
So we've got clotting, inflammation, sticky platelets. But here's the good news. Even if you have type A blood, it doesn't mean a stroke is a done deal. There's a lot you can do to reduce your risk.
Absolutely. And that's where those modifiable risk factors come in. You've got more control than you think.
Okay, so spill the beans. What does a healthy lifestyle for stroke prevention actually look like?
Well, think about a balanced Mediterranean-style diet.
Lots of fruits, veggies, whole grains.
You got it.
Yeah.
Healthy fats, like olive oil and avocados. Regular exercise is key too.
How much are we talking?
Ideally, at least 150 minutes of moderate intensity exercise every week, or 75 minutes of something more intense. And of course, keep that blood pressure in check. And if you smoke, now's the time to quit.
Basically all the things we know we should be doing anyway.
It's true, but it's easy to let things slide.
For sure. Anything else people should keep in mind?
Absolutely. Don't be afraid to talk to your doctor. They can help you assess your individual risk factors and come up with a plan that works for you.
So important. Well, this has been fascinating. It just goes to show you that something as basic as your blood type can actually reveal a lot about your health. Totally. It's all connected. Our bodies are amazing. And the more we learn, the better we can take care of ourselves.
Couldn't have said it better myself. Thanks for joining us for another deep dive. We'll catch you next time.